Welcome to Navigating the Healthcare System. I'm Dr. Page, the best guy to see on the worst day of your life. And on this session, we're going to be talking a little bit about building a healthcare team. And I want to tell you a personal story to kind of illustrate this to you. This happened 25 years ago, back before I married my wife. She was a school teacher, and my mother-in-law was a neurology nurse, an excellent neurology nurse. One day, my wife developed a fever, some chills, and just a headache. And so naturally, my mother-in-law sent her to her neurology, one of her neurology friends, and this was a world-renowned neurologist. And this goes to illustrate the point that when all you have is a hammer, all the world's a nail. So my wife, Joanna, was worked up. She had an MRI of the brain. She had a CT of the brain. She had a lumbar puncture and a full neurological workup. Well, about 6 hours into this, my wife began having abdominal pain and diarrhea. And so she went through all of this very thorough workup and ended up having a gastroenteritis, a viral infection of her intestines, which is a very common disorder. You know, it just goes to show you that the importance of seeing the right people initially. And so it's kind of like shooting a deer rifle. You know, if you're off this much off the muzzle down the road, you're off a half a mile. And so it's very important as you begin to navigate the healthcare system that you see the right people initially. And I think it begins with developing a relationship with a go-to person. This can be a primary care doctor. This can be a nurse practitioner, a physician assistant, maybe someone online that could help you to get to where you need to be. I mean, I see this so commonly in medicine. It's such a basic mistake. It even happened yesterday with my father. He had to go on an ambulance trip and ride an hour in an ambulance to be diagnosed with a very common gastrointestinal problem that really didn't even need to be in the emergency room. But once again, his primary care doctor was out of pocket and there was no one to see. And so you really need to work on developing that healthcare team so that when you go through the healthcare system, you really have, you know, those go-to people that not only see a big picture of medicine and they understand exactly, you know, what things are common and what your symptoms may be leading and know where to guide you in the right direction, that have many hammers, you know, that they can use for many different types of nails, you know what I'm saying, instead of just a focused problem. But having that person who has a broad perspective of medicine, who can guide you in the right direction initially, who you can connect with and who you have access to, and then also someone who hopefully knows you personally, who knows about you, knows about your family, maybe your past, your worldview, the way you think, you know, knows some things about you. And it's so much more difficult now in our nanosecond culture, you know. And so what we have for you today, and the first action step we're going to take for you today, and I want you to take, is to download this PDF and answer these questions. And these are really not about really the kind of doctor that you're looking for. It is a little bit, but really it's more of an analysis of who you are. You see, when you understand who you are and what your healthcare objectives are, and you know what your preferences are, and who you feel comfortable with, it really helps you to kind of know what you're looking for in a doctor. For example, there's some people like Dr. Dan. I mean, I'm sure that he has a physician that is very technologically up to date with everything, all the new literature and stuff. You know, there are other people that don't want to have the doctor to come into the room with a computer in between them and the patient. They want the doctor to look them in the eye and ask them questions and talk to them and engage with them on a personal level. They want someone that they can trust. And then there's all different kinds. I mean, some people want to have the expert in everything, and there are times for that. And so I want you to really this is more of a self-analysis to help you think about more about who you are. And I think that's the best place to start, because there are so many different type of scenarios that you can have. For example, you know, I have a Christian worldview, And but yet I go for some of my medical problems and see a doctor who is a Muslim, and I'm totally fine with that. You can imagine the dynamics there, having a surgeon who's hard-headed. I'm sure my pulmonologist friend is not very excited when I come in and start asking him questions, but that dynamic works for us. And so thinking about those things, and what may surprise you is that sometimes the people that you think you would not connect with may be the perfect people for a primary care doctor, or even a subspecialist or a specialist to see. So it really begins with you and understanding who you are. And so download this PDF and begin to asking yourself these questions. Most of the questions are kind of a scale of 1 to 10, to kind of determine, well, are you more of that technologically, person, or are you kind of more the person that wants a physician that, maybe is a little bit kind of an old-fashioned, kind of a hand-holding doctor? What are your preferences? Would you feel comfortable, going and having an interview over, maybe telemedicine or whatever? Would you feel comfortable seeing a nurse practitioner? There's some people that don't want to see a nurse practitioner no matter what, and there are other people that feel very comfortable with nurse practitioners. So I want you to think about all those things before you ever begin this process of looking for a primary care doctor. But here's the basic thesis. If you're going to be successful and save time and save money and save a lot of frustration, you have to have a go-to person, whoever that is. And I want you to begin to thinking in your mind and maybe listening who that may be. I'm Dr. Page, the best guy to see on the worst day of your life, and welcome to Navigating the Healthcare System.